Managing client care. Nurses require time management, organization, understanding how client assignments are given to the nurses, and discharge planning. Time management is the way a nurse prioritizes the client care activities based on the time frame that the nurse has. When considering time management, it is a process of planning the time accordingly to the goals that the nurse must achieve in their shift. This requires developing excellent organizational skills, meaning that nurses are flexible and can multitask to complete the care activities, remain safe, and provide a safe client environment. Nurses can perform a difficult activity. They will break a task down into smaller components by using the time management matrix that is pictured on this slide. For organizational skills, these permit efficiency and accuracy for the nurse to deliver client care. When organizing, the nurses will make SMART goals for the patient. SMART is an acronym that stands for specific, measurable, attainable, realistic, and timely. Any client goal that is written in a nursing care plan needs to follow the SMART acronym. For client assignments, this is dividing the responsibility for multiple patient care among the staff that is available. When making an assignment for the client, the charge nurse needs to look at and consider the complexity of the client's conditions. Some activities require direct care, which is client contact care. Some activities require indirect care, or they do not need a direct interaction with the client. Discharge planning is an event that is ongoing and begins upon admission to the hospital. For effective client and family education, this is considered a key component to help ensure that the outcomes are positive for the client after discharge to another facility or to their home. The ideal discharge planning acronym includes the I, including the clients and the caregivers in the discharge planning. D, discuss 5 areas: medications, the home life, any warning signs, any test results, and when the client needs to have follow-up care provided. The E is for education. The client needs to be educated on their condition, their discharge process, and what steps to take once they are discharged from the facility. The A is to assess whether or not the education that was presented to the client has been effective. The L is for the nurse to listen to the client's goals and their preferences. This helps the nurse provide culturally competent nursing care. Please stop the slide presentation and view the video on nursing time management. A nurse often delegates to another individual. When a nurse considers delegating a task to an individual, it needs to be the right task during the right circumstance that includes the right person, that is given the right directions and communication, and provided the right supervision and evaluation. For the right task, the activity that is delegated needs to be within the delegatee's or the individual's role and scope of practice. This individual needs to be competent doing this activity. This activity does not require any critical thinking, clinical decision making, because these forms of items, critical thinking, clinical decision making, cannot be delegated from the registered nurse to another individual. The right circumstance considers how appropriate is the delegated task. Is the client stable, and do they have an unchanged medical condition? As the nurse that is delegating, the nurse needs to ensure that the right person is given the right and the appropriate task. For the right person, this is who the task is delegated to. This individual needs to be competent to complete the task safely and effectively. The nurse needs to provide clear direction, instructions, and have an open line of communication between them and the individual whom they are delegating the task to. The nurse is still responsible and holds accountability to the patient's safety and welfare, and the nurse must supervise and evaluate the performance and the task completion. Abuse to a nurse will happen oftentimes by the client, and it has silently been tolerated for many years. The American Nurses Association has reported that 1 out of 4 nurses is assaulted at their workplace. The Joint Commission has provided a de-escalation training for healthcare workers that can be used to deal with the increasing amount of violence that takes place within a healthcare facility. De-escalation techniques are also known as conflict management to help prevent violent behavior, reduce the need for any type of restraint, and it also maintains the safety of the staff that is working. The nurse is directed to give calm and clear commands, maintain a non-threatening body posture, while minimizing any loud noises and bright lights. For chemical impairment, there is currently an alarming rate of clients that are receiving chemicals or medications. They may be illicit medications or they may be prescribed, and these have often led to an opioid disorder. This may happen and cause that individual to have impaired judgment or thinking and cause violent behavior. Non-adherence is also known as non-compliance with the prescribed medical treatment. This is a failure for the client to act according to the healthcare plan, which often results in a poor outcome for the client.